Hello, I'm Dr. Inman. I'm the frequency-specific laser guy. A lot of people don't realize that I began my veterinary career as a veterinary surgeon and was basically trained by some of the top veterinary surgeons in the United States. I'm proud to say one of the things that frustrated us very commonly in veterinary surgery is the dog that present themselves paralyzed or paresed to the point where they can't stand and walk. Commonly, they'll blow out a disc somewhere along their thoracolumbar spine, essentially, and that impedes the vertebral segment, actually the spinal cord in the area of the lower back, and they lose control and feeling to their rear legs. Classically, the miniature dachshund that drags itself around on its rear legs and eventually ends up in a cart, which people seem to think is kind of curious and comical as they adapt to a cart. Essentially, it's unfortunate because the animal very commonly rarely ever gets back its ability to move the legs, etc. And very commonly, a lot of those animals were destroyed instead of putting into a cart. And it was frustrating for a surgeon because we can't go in there and fix the problem that's occurring. Of course, if there's an x-ray that shows a vertebral segment that's basically been injured, severe injury like a car injury, that's something we can stabilize. However, at that point, the time of the injury, essentially, after it's over 24 to 48 hours, essentially, is not going to respond. Because of the myelomalacia associated with the neurology associated with the damage to the spinal cord. So when we see animals that are paralyzed, dogs mostly, and other paralyses that we see peripherally in the equine and the canine, in the feline, we are really depressed because you either give them steroids or you put them to sleep, which is a disaster and all. And so it's really frustrating for a surgeon to basically run across those cases because we know there's nothing that we can really do except for give them steroids and cross our fingers. About 15 years ago, it was discovered that there was a hormone created by the neural lemma, essentially by the neurological support tissue of the spinal cord and other cords. Schwann cells, esodendrocytes, and oligodendrocytes secreted a hormone called the Glial Derived Neurotrophic Factor. And what that is a hormone that is excreted by injured neurological tissues to rehabilitate, reintegrate, and reinnervate essentially the neurological tissue that's injured. Very well developed in lower vertebrates like salamanders that basically can have their tail ripped off and they develop another tail, for instance, or a toad. But the upper vertebrates don't have a sophisticated ability to do that. However, they do have this neural-derived neurotrophic factor, essentially. What we did was, about 10 years ago, we did a bunch of research trying to figure out what the frequency was that could stimulate those particular cells to create glial-derived neurotrophic factor. And we found, of course, that frequency. And that frequency that we use in most of our protocols that involve treating paralysis and paresis, essentially, in the dog, the cat, the horse, and in the human, especially for peripheral neuropathy. We use them for peripheral neuropathy. In the 1800 protocols that we use in this instrument, to treat these conditions, about 500 of them have this particular magic number, if you will, that basically stimulates the glial-derived neurotrophic factor in the target cell to rehabilitate as much as possible the nerve function. We've seen animals that have been in a cart and unable to move their rear legs for as long as 8 months. We're able to treat them successfully and get them to bear weight. Now, they still have a tendency to walk like a drunken sailor, but nonetheless they can bear weight, control bowel and bladder, essentially, and we can fix them as far out as 8 months. And of course, it's been suggested by my colleagues, surgeons, that if we don't get to these animals surgically and take the pressure off the spinal cord within 12 to 24 hours, then there's really no reason to do surgery. Very, very seldom do we ever get an animal that quickly after an injury that has lost deep pain. So what we're able to do with this technology is we're able to theoretically treat these conditions. We don't know whether or not they're going to respond until we've had a chance to treat them for at least 3 weeks. And during the first 3 weeks, or at least the 7 to 10 days, we'll see some sort of positive response. In other words, some voluntary motion and also the recurrence of deep pain. Deep pain basically is evaluated by pinching in between the toes very, very, very hard. That if I did that to you, you'd punch me in the face, not just poking them in between the leg and watching their leg withdraw, which is a withdrawal reflex, which is a lower motor neuron reflex, which is not deep pain. Deep pain basically is generating pain, unfortunately, that basically goes all the way to the skull, and the body basically, the animal is aware of the fact that they're experiencing pain. One of the first things to come back is deep pain, essentially, and so when we're lasering, we see these animals start to give us deep pain, and when we have paresis or paralysis, essentially, that's a good sign. And we're right on track. After about 3 or 4 weeks of treating this lasering at least twice a week, if we don't see any response, there may not be neurological tissue that's rehabilitatable. However, the stimulation of glial derived neurotrophic factor with this instrument has been elemental in taking care of peripheral neuropathies of all varieties, and also paralysis and paresis, including incontinence, inability to walk, control, lack of coordination in walking, essentially, and trotting, and essentially moving in general. And also we can treat these animals that have had compromised. The cat basically has a cardiomyopathic event that basically produces a clot that closes down the blood supply to the rear legs too, and that actually can be treated. There's a particular frequency for cardiomyopathy in this group. This device has 1,800 different protocols, and as I mentioned, about 500 of them have this glial-derived neurotrophic factor frequency. Before we started using this instrument, we used another frequency-specific laser that could not create this exacting frequency, so we essentially had to abandon it. Previous lasers before that actually could deliver that frequency, however didn't do it in an exacting fashion because their frequency generation was analog instead of digital, which this one is digital, and it'll deliver the exact frequency that we need to actually enhance the glial-derived neurotrophic factor when we're treating paralysis and paresis. And so classically we'll see a dog that'll come in with acute or chronic paralysis, and we'll treat them with this laser. We'll treat them twice a day for 3 days, once a day for 3 days, and twice a week for 2 weeks. And the treatment isn't any more complicated than this. Very commonly the problem is thoracolumbar at T12 to L3, essentially, in that area, and so we can basically give them 60 seconds of this for disc syndrome or paralysis or paresis protocols, essentially, that we have here. We also like to use a condition or a frequency called degenerative myelopathy, which is particularly effective and certainly carries this protocol for glial-derived neurotrophic factor, enhancing the ability for the body to rehabilitate, reinnervate, and regenerate neurological tissue. So this has been a short video on why it is that we use this instrument, and this instrument exclusively for paralysis, paresis, and peripheral neuropathy, essentially. If you have any questions about this instrument, please feel free to contact me at drbill@vomtech.com. That's drbill@vomtech.com, or you can contact me via phone at area code 208-640-3430, 208-640-3430. I'm retired here in northern Idaho, and all I do is support the people who utilize this technology for the benefit of the animals and people that they treat. Thank you very much for your patience, and have a great day.